Good evening, and welcome back to the Florida Academy of Family Physicians 9th COVID webinar, developed to support FAFP members in navigating the COVID-19 crisis. I'm Chris Scuderi, FAFP COVID-19 Task Force Chair, and I have the pleasure of introducing a very special guest tonight, Florida Surgeon General Dr. Scott Rivkees, who's going to present how Florida family physicians can address vaccination decreases during COVID-19. Dr. Rivkees will be focusing on several topics, including the current data on COVID-19 in the state of Florida, and what family physicians need to know in speaking with their patients, addressing concerns associated with coronavirus during influenza season, and implications of vaccinations for adults and children, and why the decrease in child vaccinations is concerning, and how family physicians can help be part of the solution. Before we get started, and similar to all FAFP webinars, participants will be in listen-only mode, but are encouraged to type questions that our speaker can see and will attempt to answer either during or at the end of the presentation. He has opted not to use slides, so I'm sure our audience will have questions throughout the presentation. With no further ado, let's get started by formally introducing Dr. Rivkees, who really should need no introduction, but it's what we do. As Surgeon General, Dr. Rivkees serves as the State Health Officer for the Florida Department of Health, which entails the oversight of 67 county health departments, 22 area offices for the Division of Children's Medical Services, 12 regional offices for the Division of Medical Quality Assurance, 9 area offices for the Division of Disability Determinations, and 3 public health laboratories. I'm exhausted just thinking about all those responsibilities, but Dr. Rivkees has not only shown tremendous energy, but a commitment to building a culture of health that can help each adult and child in Florida live a long and healthy life. Prior to moving to Tallahassee, he was in Gainesville as Chair of the Department of Pediatrics at the University of Florida College of Medicine and Physician-Chief of UF Health Shands Children's Hospital. Nice to have another primary care physician with us tonight. Dr. Rivkees, I'll turn the presentation over to you. Welcome, and thank you for being here tonight.
Yeah, thank you so much. It's a real honor for me to join everybody this evening, and I really want to say at the onset that I appreciate that all of you are doing as we're battling COVID-19. So I'll give you a little bit of background about where we are, and then we'll talk about vaccinations. So first, I want to refer everybody to the Florida Department of Health website, which is floridahealth.gov. And then there's a coronavirus section there. And within that, you can look at dashboards over each county down to the zip code level. Lots of information about the numbers of cases broken down by different counties, information about nursing homes as well. So as of this morning, we have more than 108,000 individuals in the state of Florida who've tested positive for COVID-19. We've had more than 13,000 individuals who have been hospitalized, and sadly, more than 3,200 individuals who have succumbed to this virus. This is a virus which, as you know, really heats its fury on the elderly and those with underlying medical conditions. About 86% of the individuals who've lost their life to COVID-19 have been 65 years of age and older. Right from the very beginning, we have really been planning for COVID-19 and continue to address it. We've had a five-point plan in the states, which we in Florida, which we call the STEPS plan. First S, social distancing; T for testing; elderly population protection; preparing hospitals for surge and protecting healthcare workers; and stopping the introduction. As far as social distancing and important messaging, this is something where we all can play a very important role. As you know, this is a virus transmitted by respiratory transmission more than anything else. And as we all are aware, wearing a mask is one of the most important mitigation measures that we can follow. Saturday evening, I issued a public health advisory urging fellow Floridians to wear a mask when it is not possible to socially distance. Several weeks ago, the state of Florida actually procured 20 million masks from the federal government, and these have been pushed out to our county health departments, which have been distributed to a whole number of organizations, including faith-based groups, elder care communities, businesses, so we can make it easy for individuals to be able to wear a mask. As far as testing, we have a number of strategies we've used to increase testing throughout the state. We have drive-through sites. We have walk-up sites. Many hospitals have CLIA laboratories. Our county health departments, again, we have 67 county health departments throughout the state. Each health department is testing at least 2% of their population per month. And these individuals were actually going into areas where the testing might not have normally occurred, areas where we potentially can see outbreaks. Going along with testing is the contact tracing. And this is something that we have done from the very beginning and continue to do so. Early on, recognizing that we would need more individuals to do contact tracing, we actually had individuals that we hired from the schools of public health along with the faculty to buttress the number of individuals we have within the Department of Health. Also regarding testing, all of you are allowed to test for COVID-19. Quest and LabCorp, other commercial laboratories will provide you with swabs. I'm sure many of you are already doing this. Excuse me. And also, there are some new self-test kits that are out there, also by Quest, LabCorp, other groups where you could actually give to your patients to mail in. So testing is something which is absolutely very important that we do. Also, in terms of antibody testing, this is something that we have also are working on. We have obtained the FDA approved, EAU approved Celex test kits, which are being used at several of our community testing sites in Miami, Palm Beach, Orlando, and Jacksonville. Also, we've recently completed a study with OneBlood, which has tested more than 70,000 individuals in the state of Florida. In the Miami-Dade area, the positivity rate is about 4% for people with antibodies, but for the rest of the state, it is about 1%. Elderly protection, this is something which is extraordinarily important because of this virus really being difficult in this elderly population. Early on, we put protocols in place for the nursing homes to be able to follow to keep COVID out. At the present time, we have more than 4,400 nursing homes and assisted living facilities in the state. About 16% of these facilities have one case or more, which means 84% of these facilities do not. So this is something we will absolutely continue to focus on. And this also is very important for individuals greater than 65 years of age and those with underlying medical conditions in the community, that they continue to protect themselves. Next, in terms of preparing for the surge, early on we had canceled elective surgery in the event that we would not have enough hospital capacity. And also this allowed us to conserve PPE at a time when it was very much in short supply. Hospital capacity always remained excellent and currently does. At the present time, we have about 3,300 individuals hospitalized across the state, 700 individuals in intensive care units, and about 300 individuals who are on ventilators. In terms of therapeutics, remdesivir is an antiviral drug which has been shown to be effective. In the state of Florida, we've received large quantities of this, which we have pushed out to the hospitals. This is for individuals who are either on a ventilator or require supplemental oxygen. So we continue to provide this to hospitals, and this has proven efficacy. COVID convalescent plasma is also available, also has proven to be efficacious, can be obtained for local blood banks. And most recently, dexamethasone in a multi-center study in the UK has shown to be effective. This probably works by damping down the cytokine storm, which causes a lot of morbidity with COVID-19. In terms of trends, as you've seen, we've had a significant increase in the number of cases in Florida over the past 10 days. and increase in number of cases, and also an increase in overall positivity. And we're seeing this more in a younger age group, individuals between 20 and 40 years of age. This is where we are seeing this very significant uptick in terms of cases. These individuals may be asymptomatic based upon published data. Individuals in this age group, up to 40% may be asymptomatic. But even though these individuals are asymptomatic, they absolutely can spread the virus, which is why it's important that we identify them. In terms of symptomatic individuals in this age group, it does occur, and there are individuals in this age group who currently are being hospitalized. Speaking to my colleagues around the state, what is noticing is that this group typically fares better than the elderly population. I would say 6 weeks to 2 months ago, it was more the elderly population that we saw hospitalized, and now we're seeing with this younger age group, which tends to fare better. However, the individual's underlying medical conditions certainly can become very ill in this age group. But this is a very significant shift that we are seeing. Other states who are also seeing the uptick in COVID-19 are also observing the shift to younger and younger individuals. In terms of the messaging that we all need to get out there, and you can be very valuable in getting this message out. And so first of all, in terms of where we are, there are 3 counties in the state which are in phase 1, and the remaining counties in the state are in phase 2. And what this means, particularly if you're in phase 2, that restaurants can be open at 50% seating capacity, bars 50%, but that is supposed to be seated service. Gyms can be open with spacing. So if we follow the guidelines, which are in phase 1 and phase 2, we can stop the spread. But as we've seen, that this is not being followed. In terms of the message, in terms of mitigation, as mentioned in the public health advisory, which went out Saturday evening, it's important that individuals wear a mask. Again, respiratory transmission, typical droplets will go about 3 feet, sometimes as much as 6 feet. So this is something that we can continue to emphasize. And as mentioned, the state has gotten 20 million masks, has distributed these, and we're getting additional ones. Other big messages: the best way to avoid getting COVID is to avoid crowds. Based upon guidelines in phase 1, you're supposed to limit crowds to no more than 10, and that includes social distancing. And as far as phase 2, limit crowds to no more than 50. And with these 50, it's expected that these individuals will continue to social distance. So it's really important that we get these messages out. It's also very important that individuals understand that if they get signs of illness, fever, cough, shortness of breath, rhinitis, pharyngitis, abdominal pain, sometimes diarrhea, that these can all be symptoms of COVID, other flu-like illnesses, and individuals should get tested. We also need to continue to encourage our patients that if they are ill, that they don't go to work and they get tested, and by all means, they should really avoid making sure that they're not in contact with individuals with underlying medical conditions or individuals older than 65 years of age. Many businesses now are having screening for work, symptomatic checklists. In some companies, businesses doing temperature screening, and as students will return to school in the fall, both K through 12 and for university, we anticipate that local guidance will take place where there will be screening of individuals. This means that that those of you who take care of adults and pediatric patients will have individuals with nonspecific symptoms who will need to be tested for COVID-19, which is why it's important that you have the PPE, which basically consists of a face mask, surgical mask, and a plexiglass face shield, and be able to test your patients for COVID-19. And if that's not possible, make sure you know in your local community where both children and adults can be tested. And also, as mentioned, Quest, LabCorp, and other companies now have these self-swab kits, which you could give to your families that they can test and send in. In terms of the message that we really have to share with everybody in the community is that we all play a role in slowing the spread of COVID-19. Continue to emphasize your patients. This is spread person to person, and that by wearing a face mask, the other mitigation measures, and certainly by not going out when they're sick, can play a role. At our Department of Health website, we have lots of infographics that are available for you to download. Next, I'm going to talk about vaccinations. So, as you are aware, there has been delayed health care as part of this pandemic. And this is influenza routine care, which includes vaccinations, both in the pediatric population and also in adults. Often we focus on vaccines in children, but absolutely adults need vaccination. And recent data suggests that more than 35% of adults are behind in their vaccines. As far as vaccines for school year, with the school year typically starts sometime in August, it is the expectation that children will get caught up on their vaccines before school begins. Same thing for colleges, where meningitis and hepatitis B vaccine are required, and colleges will continue to insist on this. So how do we get individuals back for health care? How do we get individuals back vaccinated? So the Florida Department of Health, we have messaging campaigns trying to encourage individuals to go back and get the medical care that they need, which includes vaccinations. It's really terrific, the interest of the Florida Family Physicians working with the Department of Health, trying to also get this messaging out, as this is so important. And then we're also working with the Florida chapter of the American Academy of Pediatrics. Also, it was mentioned earlier, the importance of influenza vaccine. Yesterday, I was at a Board of Governor meetings where the different state universities in the state were presenting their plans for beginning face-to-face education again. And many of the universities talked about the importance of influenza vaccine. And this is something that's going to be extraordinarily important to do as symptoms of flu and COVID are going to overlap. So this is something that we will begin messaging on and continue with it. And also in terms of flu vaccine, last year there were about 10 children who lost their lives to influenza, again, vaccine preventable death. Also, in terms of vaccines, I do also want to talk about hepatitis A. Before this pandemic started, we were in the midst of a hepatitis A outbreak. And this is something that we had very aggressively countered and worked on. Again, hepatitis A, individuals who have any form of underlying liver disease should be vaccinated against hepatitis A. This is individuals who have challenged social situations, homelessness, substance abuse. These are individuals who are most at risk for hepatitis A. And we've made substantial progress in hepatitis A really over the past year. In August 1st, 2019, actually declared a public health emergency about hepatitis A this continues to remain in effect, and our Department of Health teams, while they are also battling COVID-19, are also focusing on hepatitis A, and the numbers have decreased dramatically. But again, while we're focusing on COVID, while we're focusing on influenza, really appreciate everybody's input in terms of hepatitis A. As far as other Department of Health resources, we have a website for the Department of Health vaccination program, has lots of information there, has FAQs there. Also, I'm sure most of you are already enrolled in Florida Shots. This is an important portal where we can keep track of individuals who have been vaccinated, and also gives parents a way to be able to track their vaccinations as well. So again, I really want to thank everybody for your collective efforts. These are really such unusual, such unprecedented times that we are all dealing with. And with your support, there's no question that we will get through this. And again, thanks so much for this special honor to speak with you tonight.
Excellent. Thank you, Dr. Rivkees, for a great presentation. We do have a number of questions. The first was, today there was a study released by the, projection released by the University of Washington's Institute of Health Metrics and Evaluation, showing that there will be approximately 180,000 deaths by October 1st if nothing changes, but the number would drop to 146,000 if 95% of Americans start wearing masks in public. What do we need to do to encourage that, to really make a difference? You know, over the past couple of weeks in Florida, it seems like when you go out, there's less and less people wearing masks in public. What do we need to do as family physicians to change that tide?
Yeah, thank you. It's a really important question in terms of all these projections, are predicated on us doing certain things or not doing certain things. So, we just have to encourage everybody when they come into our office to wear a mask. Ample evidence shows their effectiveness. This is why issued a public health advisory this past Saturday evening. Also, many counties are now issuing mask ordinances, and many of you on this call I know are involved with your local communities. So, be strong voices, continue to message to the community, again, that this is a person-to-person transmitted disease and that we can stop the transmission by doing the measures that we talked about: wear masks, social distancing, avoid crowds, and certainly not going out when you are ill. Also, in terms of masks, as mentioned, our county health departments, we got 20 million masks that we have already distributed. We gave them to faith-based organizations, different businesses, anybody who wanted them. So if you know groups that are interested in getting masks, contact your local county health department, and we can do this. And again, for all of us on this call, we're all role models. When we go out in public, we'll be recognized as healthcare providers, and this sends a strong message when they see us wearing a face covering.
Thank you for an excellent answer. So the next question we have is that many parents are concerned with less than 2 months to the new school year. What is going to happen? How can family physicians be prepared to speak to parents around the state for what they need to prepare for?
Yeah, thank you. So first, in the pediatric population, children are more likely to get COVID from their parents than from other children. Several studies have shown this. So first, this starts with parents protecting themselves from getting COVID, avoiding crowds, having a face mask, having social distancing. So that's one. Second, each school district is working with the local county health department to come up with plans for the school year. What type of screening will take place? What happens when students become ill? How do we make sure that students have testing? how are the school nurses engaged? So there's a lot of planning which is going on at the present time to try to help students get back to school in a safe way. So again, it gets to the messages that we talked about in terms of the mitigation measures and making sure that parents understand that they protect themselves.
Thank you, Dr. Rivkees. A number of family physicians are small business owners or independent physicians. Do you foresee that there'll be any liability protection for cases related to COVID exposure for these small businesses?
I tell you the truth, that's a question that's outside of my wheelhouse, and I don't have an answer to that. I don't have any firsthand knowledge of that. I'm sorry.
Okay, excellent. Well, thank you. And then another question came in about testing. How do you feel about our current state of testing, and how can we improve it in the state? And what could family physicians do to help with that?
Yeah. So first of all, the state currently has capacity, and in addition, our state laboratories are also ramping up their ability to do testing. So first, we have many sources: commercial laboratories, Quest LabCorp being the leaders. They continue to add on their capacity. There are many hospitals that have CLIA certified laboratories, and in fact, on regular calls I have with the Florida Hospital Association, I've been encouraging hospitals to be able to make sure that they can do their own testing. Our Department of Health laboratories do testing, and we are really we're adding additional equipment to our laboratories, so we'll be able to increase this dramatically. And physicians, all of you on this call can test for COVID. You can contact your commercial laboratories. They will give you the kits, they'll give you the swabs, and then also the self-swabs that individuals can do. So this is something that we currently have capacity, is something that we continue to be adding onto so that we can get more individuals tested as well. And then also in terms of nursing homes, we recently completed testing for COVID-19 in more than 3,500 nursing homes. This is of staff, of residents who wanted to be tested. And this is something that is going to continue going forward also, where about every 2 weeks, nursing home staff will be tested as part of a sentinel surveillance program to make sure that we keep COVID out. So again, lots of testing. Testing will continue to expand for the PCR. And then also in terms of antibody testing, again, this is commercially available by venipuncture. Several laboratories, Quest, LabCorp, others also offer the antibody testing as well.
Excellent. Thank you for the great information on testing. We have a question coming in about with the second wave coming at levels even greater than the first, what planning measures are being considered to address the potential for scarce resources of ventilators, PPE, and more as we brace for the surge?
Yeah, thank you. So first of all, when we had, when we in March and April, there were really significant supply chain issues related to PPE. This was one of the major reasons why elective surgery was stopped, or elective procedures were stopped to allow for PPE conservation. The supply chain has improved, and so PPE is not in short supply at the levels it was in the past. So that's the first thing. Second, in terms of ventilator capacity, so right now, as I mentioned, there are about 300 individuals on ventilators in the state. Should also point out that of the individuals who are hospitalized now, and of the individuals who are in intensive care units now, collectively in the state, about 20% of these individuals are those who have COVID-19, meaning the majority of patients who are in intensive care units, the majority of patients currently in hospitals don't have COVID-19. And even that said, at the present time, we have more than 17,000 hospital beds that are currently available. We have more than 1,600 intensive care unit beds that are currently available. And as we're seeing with the change in the demographic, these are typically younger individuals who are not as ill. But this is something that we are following very, very closely. As far as therapeutics, as mentioned, we now have COVID convalescent plasmid, which is available from blood supply, remdesivir, which the state has gotten from the federal government, and we're pushing out as a therapeutic. And then also we have dexamethasone. And then also in terms of how we care for these patients, prone ventilation, high flow nasal cannula. We have also obtained those to push out to the hospital. So with these collective measures, we should be we're in a situation to be able to respond even to more patients.
Thank you. Received a question about masks. One of the members of the audience was asking that if patients come into the office with a cloth-based mask, should the office replace that with a surgical mask? Are there any studies or evidence to show that one's better than the other in a physician's office?
Yeah, so studies have done side-by-side comparisons, with the surgical masks versus the cloth masks. And there are different types of cloth masks made out of different materials, and some are better than others. With a good cloth mask, it's thought to be 70% less efficient than a surgical mask. Again, we don't really know how individuals have made the cloth mask. That's an interesting question. So I would say if anybody has any concern looking at the cloth mask, if it looks tattered, if it looks worn, I like the idea of offering them a surgical mask to replace it. But again, a cloth mask will definitely slow transmission above not wearing anything.
Fantastic. And then, as a pediatrician, what do you see the state of youth sport as we enter the fall? Do you see that, kids will be able to play soccer and football again, or what can we prepare parents for as the fall season comes?
Yeah. So again, this is something that we are going to learn as we go along. I should point out that CDC has put out lots of guidelines for youth activities, school activities, university activities. And, what has been recommended for school programs, particularly, first of all, outdoors, the virus is less transmissible than indoors. And so that's something which is clear. And people have talked about outdoor activities. You end up having smaller groups, emphasizing hand washing, emphasizing children not being bunched up against each other as much as possible. So again, having smaller groups, activities outdoors, hand washing, trying to avoid contact as much as possible are measures that have been recommended. And again, if an individual gets sick, it's really important that individual end up getting tested and not participate either in school or in organized activities until we know that individual is clear.
So thank you. I know it's just unprecedented times, and so I know a lot of parents and kids have two children, and they're constantly asking, what's August going to look like? So, the next question I have is over the past couple months, family physicians really have had to turn to telemedicine to take care of their patients and to be able to continue to provide great care, especially during the times when things were shut down. There's huge concern amongst family physicians that as soon as this passes, a lot of the payment parity for telemedicine is going to go away. What are your thoughts and feelings on that for primary care?
Yeah, so in terms of the payment and reimbursement structure for telemedicine, this actually is something that falls under the umbrella of the Agency for Healthcare Administration and some of the other agencies. So in terms of what's going to happen down the road, I don't have insights about this. But one of the things that we have learned, and very grateful for telemedicine, because this has allowed lots of individuals to receive care in so many different ways, certainly mental health, in addition to other forms of medicine. So even physical therapy, telemedicine has been used. So I think one of the things we learned for this is that the importance of telemedicine. And as far as reimbursement, payments down the road, I'll have to defer to other agencies in terms of what the future holds for that.
Okay, thank you. I think for the group, though, if you can advocate for that, I think that would be fantastic, because it's become a big part of the practice.
Yeah, absolutely. I'll relay that question along. Thank you.
Thank you, sir. And so we received another question about, are there any guidelines or recommendations for screening pregnant females for COVID-19?
Yeah, so this is something that is interesting. In terms of guidelines from specific organizations like ACOG or your organization, I don't know what the latest guidelines are. I know that in some hospitals in the state, they've done routine screening of all pregnant women for COVID, and in other places have not. I would say it depends on your community. If you're in a community where you're starting to see COVID in the younger individuals 20s, 30s, and 40s, and I know this has become part of standard care at many places, I think you try to follow those guidelines. It's also interesting that many pregnant women who are COVID positive actually turn out to be asymptomatic. So you can't necessarily tell based upon symptomatology as well. So, like I said, it probably varies it does vary by the institution. I know some institutions are doing screening, whereas others are not.
Thank you, Dr. Rivkees. So I think we're getting towards the end of the questions here, but just, is there any final message that you want to get out to Florida physicians, for COVID or beyond? Is there, anything that, you want us as a take-home message that we need to know as we fight this together?
Yeah, no, that's really important. So, we all of us in healthcare play a role in stopping the spread. And a lot of this has to do with messaging, making sure that the public realizes that this is a serious virus, that this is a virus that has claimed 3,200 Floridians and has put 13,000 of us in the hospital, and that it remains serious, and that it is around, and that there are measures that everybody can take in terms of slowing the spread, masks and the mitigation measures that we had talked about. I know that your local communities will look to you as practitioners for their guidance, and I would say, work with them to make sure that you can give them the guidance that they need. Also, in terms of testing, this is really a huge part of our fight against COVID-19. And even though we focus on community walk-up testing sites, drive-through sites, testing in the emergency room, testing in urgent care centers, COVID-19 is going to be with us for a while. So if you're in the office, and let's suppose you can do a strep test, if you test for flu, you should also be able to consider testing for COVID-19. And like I said, the commercial laboratories will be able to make the swabs available to you. And then also in terms of getting caught up on healthcare, which is deferred, which includes vaccinations. We have a little bit of time before children go back to school, before college students go back to college, to make sure that they get caught up on their vaccines as well. And then lastly, like I said, really appreciate all that everybody is doing. If there's additional information that you need, if there's infographics that you think will be helpful to your patients in your community that we have not made, please let us know, and we'll be happy to work on those with you.
Excellent. Thank you so much, Dr. Rivkees. We appreciate your leadership for our state during this unprecedented challenge, and we appreciate you taking the time tonight to share just, how we can participate in taking care of Floridians during this time. And it's been excellent presentation, excellent information. So, on behalf of Florida's family physicians, we can't tell you thank you enough for being with us this evening. For the audience, please remember that questions after tonight's session can be emailed to the FAFP, so answers can be provided. Furthermore, all FAFP webinars are available on demand by going to www.fafp.org. We hope that you'll join us in late July for our next webinar featuring the topics updates in primary care you may have missed during the COVID-19 pandemic. Tentatively, we're shooting for Thursday, July 23rd, but we're just finalizing the speaker of the date, so please keep your eye out on the FAFP website and social media for updates on that topic. Also, if there's any future topics that are needed or you feel like that we can help during this time, please let us know and we'll look to develop those. Also, don't forget to register for the FAFP's virtual summer forum on July 11th when Dr. Vincent Hsu will present the latest data on coronavirus and more. And so just want to, again, thank Dr. Rivkees just for the amazing presentation tonight and for taking the time to just share your expertise with us. And want to thank everybody for participating on this webinar, and just thank every family physician for all you do for your patients. Good night, be well, and stay safe. Thank you.